Okay, so there's the increase in premiums. Now, 47 states, not all the states, 47 states have already done, okay? One more thing, and I'm loving that you're working with me. Stand up here for a second. Stand up here with me for a second. You're a bit shorter, I noticed. Okay. What they're really asking is that we go into the Gap and we all buy the same pair of jeans.
All right, Jimmy.
Okay, now, your jeans
Suck it up, Jim.
and my jeans and Sherry's jeans are not going to fit any one of us very well, depending upon which size we decide to go to. I'm kind of probably between the both of you. Okay? I do have long legs. You can roll yours up though, or you can roll them up. That's what they're doing. Saying, okay, what fits you should fit me, should fit you. Thank you. That doesn't work that way. Okay. Go ahead, I covered that. Okay, so there's the increase in premiums. Now, 47 states, not all the states, 47 states have already documented and declared what their premium data is. So take a look at this. 42 of 47 states for which comparable premium data is available will see significant average premium increases, in many cases over 100% increase for individuals purchasing from the exchange. Over 100%. Obamacare's overregulation of insurance is to blame the lack of competition in the exchanges. Next, please. More bureaucracy, more rules. Obamacare imposes rules, regulations, and restrictions on physicians. Now, physicians really aren't, although there are some amongst us, physicians really aren't the pompous, rich people that are trying to get richer. We really went into medicine to help people. But we are really a mindset of people that we've worked our butts off to get where we're at. We've paid lots of money to get where we're at. And we do feel like there ought to be some sort of compensation for that. Not only, and truly we're not looking to get wealthy. And believe me, in today's world, we're not going to get wealthy. But somehow or another, in the industry of medicine, right now, I've been out of medicine, or out of medical school, and out of my residency for 13 years. Okay? When I became a resident, I was really glad because I got my first paycheck as a real doctor. Not much as a paycheck as a resident because you're still in training, but I got my first paycheck, and I was excited. The other thing I was excited about, and it was as ridiculous as the first paycheck, was me, I had a pager. So I knew I had a ride. By the end of the day, I really wanted to ditch the pager. But the salary was, I was elated as a salary. 13 years ago as a resident. Guys, right now, my salary is less than what it was 13 years ago before I had any experience. And I'm not the only one in that category. Okay? So when you think, gee, the physician's salaries, and they just, if they weren't the pompous fat cats and want to get richer, as it's not happening. And I'm not sharing that for any level of sympathy, but level of awareness, because that's what's happening. Okay? So Obamacare creates a non-profit patient-centered outcome research institution. Now look at this. What's happened to Obamacare is they're trying to do this healthcare reform, but they've needed new institutions, they've needed new czars, they've needed new people to try to do something with it. So they're dumping millions of dollars into a system. But this is one of the institutions that they've created. They've created a non-profit patient-centered outcome research institution that will be examining clinical effectiveness of medical treatments, procedures, drugs, and medical devices, and base accessibility and cut reimbursements on these findings. Okay? So rather than my sitting in my office and saying, Cindy, I really think we need to have this procedure. Okay, you're seeing me. I've got a medical history. There's going to be this institute saying, well, you know what? That didn't work for X, Y, and Z. So, no, we're not going to cover it. okay? Or, based on your outcome or patient outcomes, I'm reimbursed according to how the patient does. Now, I would like to tell you that every patient I have is amazingly compliant, takes every medicine on the hour that they're instructed to do so, is exercising when I'm saying they need to exercise to get their lipids and get their cholesterol and to get their blood sugars down, that they need to be exercising, and forget going to the ice cream store and the pasta that you have at night. No. I'd love to say that every patient's that compliant, but they're not. I have no control over that. I can encourage them. I can tell them the outcomes. I can tell them that if you don't, what the outcomes of diabetes is going to be. But you know what? When it's all said and done, I'm going to have some institute in Washington telling me how much I ought to be reimbursed because my patient failed to be compliant. That doesn't seem fair. Next.
Is that death panel?
I'm sorry?
Is that the death panel we're talking about?
It is a death penalty, but
Yeah, no, that's organization. You said that.
no, it's if you decide to pick up the actual name of the institution, that is the name of the institution.
Well, they're not going to call it death panel.
No. But, yes.
But Sarah Palin was right when she said there are death panels.
Yes. Yes. She was right when she said there were death panels. Okay. Also, the IPAB, okay? That's the Independent Payment Advisory Board. Now, it's comprised of 15 bureaucrats, non-elected 15 bureaucrats. And they're going to tell us what the reimbursements ought to be. Okay. Their goal is to reduce the per capita growth rate in Medicare spending in accordance with specific targets. Now, guys, I have to tell you, how many of you, I just want to see a quick show of hands, how many of you, your doctor's written a prescription, you take it to the pharmacy, and they tell you it's not on your formulary? Okay, and we just kind of want to show hands? Okay. Now, let's magnify that, okay? I just spent the last 20 to 30 minutes with my patient in the exam room, and we decide they need this medicine, okay? They go to the pharmacy says, oops, nope, your insurance doesn't can allow that. So then I have a choice. Go to a generic or less expensive drug, try that, and when we see that that doesn't work, maybe try again. But I have somebody in my office that does these prior authorizations. Okay? The prior authorizations are going to be more and more and more of a demand. Okay? Now you know what that does to work hours? That means that you have to have somebody else in your office just doing prior authorizations. You know what? We didn't go into medicine to fight the bureaucrats and say, I want my patient to have this medicine, or my patient needs his procedures. At some point in time, physicians are throwing up their hands and saying, forget it. Forget it, I'm done. I'm done. But the only mechanism for IPAP to be available to control spending is through reimbursement cuts. Okay? So suddenly we're asked to do more, to fight more to be the patient advocate, and to make less. Somewhere along the line it becomes, are you in the red or are you in the black? And if you can't do it, you can't do it. Next, please. It is a healthcare rationing body. Do not be fooled. Your healthcare is going to be rationed by somebody in the White House. Next slide, please. So what's happening? What's the outcome? That physician dissatisfaction. 2 years ago, I'm the division chairperson at the hospital. So meaning that anything that's internal medicine and anything that's primary care is under my domain. And at a medical executive committee meeting that had all of the administration of the hospital, we talked about the dissatisfaction of physicians in the community. And we recognize that it is at an all-time high. And we're saying, what can we do to help that? What can we do where a physician isn't so dissatisfied that they're walking out, that they're walking out of the community, walking out of the hospital, taking it out on the nurses, taking it out on the patients, taking it out on their home life, divorce rate is higher, things going crazy, what can we do? But the dissatisfaction rate is so high amongst physicians. In this community, in the past year, since January, we have lost 38 physicians have left this community. This is a small community. Had 38 physicians leave. Some took early retirement, some went to larger cities, some just said, I'm done. Others have gone into other sorts of businesses. 38 physicians have left. Okay. By 2020, the nation is going to need 91,500 more physicians than the current number. That many more physicians. Now guys, you can do the math, that's 7 years. It took me 12 years to get through medical school. Well, not medical school, my medical training. It was 12 years to go through. 7 years from now, we're going to need 91,500 more physicians. Next thing. By 2020, there's an anticipated shortage of physicians by 50,000. Do the math, we're 151,500 physicians short. But we're dumping more people on the system saying we're going to cover this many more people with that many more fewer physicians. Do you know what's happening right now? Walgreens and CVS are hiring mid-levels. They are hiring nurse practitioners. They are hiring physician assistants. So rather than going to your doctor, you can go to your pharmacy and get your health care. Now, don't you feel valued with that?
Stop shopping.
One-stop shop, that's exactly right. Okay? You know, in the 1990s, a law came into being that a physician couldn't have ownership and partnership in pharmacies because there was a conflict of interest. Go to your Walgreens, get your health care. You think there's a conflict of interest? Okay, next slide, please. Okay, Obamacare absolutely exacerbates the physician dissatisfaction regarding our attitude towards the whole healthcare system. Okay? Guys, I'm the youngest internist in town. Now you can tell I'm not 29 anymore, but I'm the youngest internist in town. And right now, we cannot find physicians to come back into this community. I've been looking for a partner for 5 years. I've got a beautiful office building. My builder went over the top. I've got a good payer mix. My staff are Christians. Those of you that are in my office, you know it's a pleasant experience. At least I hope it's always pleasant. But I've been looking for a physician for 5 years. Not been able to find one. We created a residency program here to train physicians. One of our hopes in that was that as we trained physicians, they would stay in the community. They would train here for 3, 4, 5 years, however, depending upon what residency they're in, and that they would stay in the community. Of the 3 graduating residents for primary care this year, none are going into office-based care. They're going to be a hospitalist, and they're going to become subspecialists. Now, for those of you that don't know what the hospitalist is, a hospitalist is a doctor that simply works in the hospital. They don't have an outpatient practice. They work in the hospital, so they have their list of patients that they see day by day. You don't see a primary care doc when you're in the hospital anymore.
Terrible.
It is terrible. I'm the only physician in town that still sees my own at the hospital. Okay? And I'm not saying kudos to me. What that really does, though, is the reason for that is because the craziness. Okay? To go up to the hospital, also make rounds, and then have to see the patients that you have to see in the office and jump through the hoops that we're having to jump through right now, people say it's not worth it. So you relinquish your care of your patient to those doctors that are just in the hospital that are working shifts. They might work Monday, Tuesday, but by Wednesday there's somebody else on. So if you happen to come in the hospital on Tuesday and happen to be there till Friday, you might have 2 or 3 different docs. None are your primary care docs. Okay? There are some communities across the nation that do not allow their physicians or primary care physicians anymore. They're only allowing the patients to be seen by the hospitalist. Okay? A portion of our community hasn't come to that. And I'll go down fighting it because I think my patient deserves to see their primary care doc when they're sickest, when they're in the hospital. Yes.
Is it okay to ask a question?
If we can probably save questions to the end, or if you need to jump in, you can.
Oh, I'm just curious about your last comment. Why are the hospitals restricting primary doctor from the attendant physician?
Part of that is because the incentive then that goes to the hospital. Okay? Because when I go see a patient in the hospital is reimbursed for the bed and the stay and the care that the hospital does. They're not reimbursed on my services, okay? For the hospitals, because they're employees of the hospital is reimbursed for their services, okay? So it's reimbursement based, okay? But I can walk in when I've known a patient, okay? And I said, I'm just gonna pick on you for a second, Karen. I've known this lady, how many years have you seen me? Okay, but I know her well enough that if she's laying in a hospital bed, I can size up in 30 seconds how sick she really is. I know her. Okay? Now, even those patients that are carrying oxygen behind them and are sick, I can walk in and say, nah, he looks like this on a good day. Or, no, they need help now. Okay? So I think the patient deserves that, but again, with the reimbursement, it's de-incentivizing physicians to do that. Okay? The other thing, guys, I'm single and I live simply. I don't have a family trying to go through kids that are going through college and, I still need that. My biggest amount of income goes to my student loan still, okay? But I don't have that. So the physicians aren't being unkind and they're not money mongers. They're trying to survive. So, but all of this is to de-incentivize physicians. Okay. The end result, okay, is individuals and families will be forced to pay higher premiums for lesser insurance. It's causing doctors will be forced to choose what tests, medicines, and treatments will be implemented based on government choices, not patient needs. I just want to share with you real quickly, and I don't know how much time I have. Karen hasn't told me how much time. Okay. My story. I've been in this community since '99. And I was part of Southwestern Medical, which is was a large Christian organization here. Lots of Christian docs, and they did a lot of foreign missions. That's what moved me here from Oklahoma. Love Southwestern. Within the past couple of years, they've been forced to integrate with the hospital. But I worked with Southwestern for 3 years. And then